Good afternoon, members. It is the appointed time and we have a quorum. The special meeting of the Finance Committee, its afternoon session will begin now. There will be two sessions until 6:55 p.m. The purpose of the special meeting is to scrutinize the expenditure estimates of the 2026-7 estimates to ensure that the allocated funding amounts will not exceed the necessary amount. I remind members all your questions must be directly related to the expenditure estimates, and please quote the program the head number, the question serial number on the top right-hand corner. I remind members this session is for LWBW session. For the Labour and Welfare Labour session, that will be conducted at 5 p.m. If your answers have not been answered at the meeting, please submit supplementary questions to the Secretariat before 7 p.m. today. They should only be restricted to the written supply given by the government. Now, this is a session on welfare, poverty alleviation, and children. I will invite the Secretary to give us a briefing, and then you can ask questions. Please press the button now. Mr. Crisson. Thank you, Chairman and members. In 2026-7, government recurrent spending on social welfare is estimated to be $135.9 billion, accounting for 22.7% of the total recurrent government expenditure of the year. First, amongst all policy area groups. Compared with the revised estimates for last year, that is $123.6 billion, there is an increase of about $12.3 billion in recurrent spending on social welfare, some 9.9% increase. Now, let me highlight several key programs. First, elderly services. The recurrent government expenditure for elderly services this year is $17.5 billion, representing an increase of 27% over about $13.8 billion 5 years ago. Starting from this year, we will increase the number of community care service vouchers for the elderly by 4,000 to 16,000, and the number of residential care service vouchers for the elderly by 1,000 to 7,000. The two voucher schemes involve an annual expenditure of about $1.2 billion and $1.97 billion, respectively. On cash assistance, this year's budget proposed to provide a one-off extra one-month allowance to eligible recipients of Social Security payments, which will incur an expenditure of about $6,290 million. Similar arrangements will apply to the Working Family Allowance households, incurring an expenditure of about $196 million. To further facilitate cross-border retirements for elderly persons, in 2025 policy address, we have announced the improvement of disbursement arrangements for portable cash assistance, so that Hong Kong elderly beneficiaries retiring in Guangdong and Fujian may opt to receive government cash assistance directly through their accounts with designated mainland banks. The new service will be launched in the middle of this year. On support for persons with disabilities, this year's budget announced two major measures to enhance rehabilitation services that are to provide about 450 additional spaces for day, residential, and preschool services in the financial year of 2026-7, and for children with special needs receiving on-site preschool rehabilitation services to provide bridging and support services during the first term in primary school, starting from this school year. The two measures will in total involve an additional annual expenditure of about $367 million. On assisting working families in childbearing, starting from this financial year, in the next 3 years, we will increase 15 new aided standalone childcare centers, almost doubling the existing number of service places. On child protection, the mandatory reporting of child abuse ordinance has come into effect in January this year. We will continue to ensure the smooth operation of the ordinance, including continuously monitoring the operation of the mandatory reporting mechanism, ensuring the adequacy of relevant supportive measures, including emergency placements and professional support, and continue to provide trainings for specified professionals. To strengthen the prevention of child abuse from source, the government will allocate an additional provision of $96.9 million from 2025 to 2029 to 30 for setting up 4 community parents and children centers on a pilot basis, promoting parent-child interaction through play-based services, and instill positive parenting skills in parents, 3 of which have commenced operation earlier this month, while the 4th is set to begin service shortly. On implementation of productivity enhancement program, which is close to many members' hearts, the Financial Secretary has announced in this year's budget that the government will take forward the productivity enhancement program as planned to support NGOs operating subvented welfare services in implementing the productivity enhancement program. The LWB and the Social Welfare Department have reallocated internal resources and adjusted priorities to alleviate some of the financial burden on NGOs. In addition, since March last year, the SWD has relaxed the utilization of various reserves, streamlined cost apportionment procedures, refined the funding and service agreements signed with NGOs, and so on. Starting from April this year, we have also rolled out a series of new support measures, including extending the coverage of streamlined cost apportionment procedures to the Jockey Club Charities Trust, the Community Chest, and 3 additional government-funded projects, refining and streamlining the service quality standards and enabling a more flexible use of the block grants provided under the Lotteries Fund so as to enhance NGOs' financial flexibility and streamline administrative work, helping them to implement the PEP while focusing the resources and efforts on delivering services, maximizing the effectiveness of public money. Finally, the $2 scheme. We have announced in last year's budget to change the $2 scheme to the $2 flat rates or 80% discount scheme. It has successfully taken effect on the 3rd of April this year with smooth operation. I would like to thank all council members, district council members, care team members, local community, and social welfare organizations for their assistance in the promotion of the scheme. It is estimated that the implementation of this enhancement will save approximately $550 million in public expenditure for this year, including the savings resulting from the reduction of taking long-haul routes for short journeys by beneficiaries. The freed-up resources can be used to address other needs in society, including the aforementioned works on elderly services and other areas. That concludes my opening remarks. We were pleased to answer questions. Thank you, Secretary. There are 29 members who have pressed the button. They are Ms. Maggie Chan, Ms. Lam Shen Singh, Webster Ng, Brave Chen, Ms. Ginny Man, Professor Lau Ji-pang, Mr. Eric Yim, Hong Kam-in, Stephen Ho, Chao Siu-chung, Kenneth Lau, Ms. Nixie Lam, Elaine Chik, Kwok Fu-yong, Mr. Augustine Wong, Mark Chong, Ms. Christine Fong, Mr. Andrew Lam, Ying Pang, Ms. Rebecca Chan, Lau Ka-keung, Bill Tang, Chen Pui-leung, Kingsley Wong, and Ms. Chen Meng-yi. We still have 110 minutes left for this session, so 25 members each will have 4 minutes, including questions and answers. Please do not ask 3 or 4 consecutive questions. Limit your questions to 2 to be fair to others. Ms. Maggie Chan. Thank you, Chairman. My first question is on my own question, number 37 and 38, both on supporting the increasing the number of service places of 8 standalone childcare centers. Now, there are 1,536 service places, which is not enough. There will be 200 more, and I support that. Now, according to the annex, the usage rate for each district is different. For some, the usage rate is 100%. For some, it's lower than 50%. So how will the government maximize the utilization of the service places to give more quota places to needy districts? And has the government made reference to the demographic structure in the districts, including the number of families with 2 working parents? Now, 39, it mentioned that there will be the establishment of a data platform for carers. So that will involve some $105 million. Can the government allocate more resources to speed up the establishment of a database for singleton and doubleton elderly households? Secretary. Thank you, Ms. Maggie Chan. First of all, on 8 standalone CCCs, indeed, there's different utilization rates for the different districts since the needs are different. But overall speaking, there is great need. That's why there will be 15 more CCCs in the next 3 years. I can defer the question to the Deputy Director, but I think we will be able to use all the quota. Second, using big data technology to identify needy elderly households. The data does exist. It's only a matter of connecting and integrating the data. There are two hurdles. First, identifying the data, which we have done. We need to comply with the Personal Information Privacy Ordinance. We have consulted the Commissioner for Privacy. On the premises of full compliance with the law, we will gradually open up the data platform, especially for helping single or double-ton elderly households to see if they need support. If they are not supported by any organization, we will arrange a case manager to help the cases as soon as possible to be proactive. I will defer the question to the Deputy Director of Social Service concerning the CCC situation. Thank you for raising the question on utilization rates of standalone CCCs. We are aware of the pattern. The number of children in different districts are different. So based on the different needs of different districts, we would make plans for establishing CCCs in different districts. There are a number of factors in play, including whether there are suitable premises. So we would consider the utilization rates before we make the plan. Ms. Lam Chen Sing, thank you. Number 79 and 105, concerning the supporting scheme for the unemployed, there are some 9,500 participants, but the employment success rate is only 28%. So I know these job opportunities are unpaid, but we have to be serious about the scheme. CSSA recipients are the disadvantage in society, but can we engage some quality corporations to provide employment opportunities to these grassroots workers so that they can be hired as permanent workers in the end? Second, question 105, on-site after-school care program. There are 205 primary schools participating, and the government said it would expand this scheme. So what will that be like? Are you just going to increase the number to 300 schools, or are you going to extend the service hours of the program, or extending the eligibility to more non-CSSA recipients? Or would the government make the program a recurrent funding program without the support of CCF so that the parents don't have to apply for the scheme every year? Secretary, thank you. First of all, under CSSA, we require beneficiaries who are capable of working to join the support program for the unemployed. But it's very hard to set a KPI for the program. CSSA recipients have their own difficulties. I will defer the question to my colleague to expand on that. On school-based after-school care service scheme, I will defer the question to the Permanent Secretary. Ms. Alice Lau, thank you. Concerning the after-school care service scheme, the figures mentioned by the member is correct. For the next stage, we will not set a cap for the number of schools under the scheme. In other words, we will use different methods, including incentives, to encourage more schools to join. Even if there are only a small portion of students in the school who require the service, we will still ensure that there is sufficient administrative support for the school. Now, for the next stage, besides supporting families with financial difficulties, can we extend the scope? Well, actually, that's the intent of the program. Even if a family is not a CSSA recipient or a recipient of other cash allowance, the students can still join. But we will charge a nominal fee to distinguish the two groups of beneficiaries. So at present, even non-CSSA recipients can participate in the program. Now, the program has been implemented for quite some time, and we have seen some very successful examples. So we will share these experiences and also the positive feedback from the beneficiaries with society to encourage more schools to join. Thank you.
Dr. Webster, thank you, Chairman. I'd like to follow up on 168 and 169. These are my questions. Regarding reply 168, $13.7 billion, and 90% of the amount is spent on government provisions, whereas only $1.4 billion is for the provision for the subvented or private sectors. The situation is getting more and more complicated. I'd like to know how the administration will handle the workload while not compromising service quality. Reply 169, the administration referred to making good use of resources and increasing cost effectiveness in the answer. However, in part B of my question, I made it very clear already. I'd like to know where could money be saved. A drop of 3% in elderly centers, daytime elderly centers. How did the administration successfully save money? Through meals, through other areas? I cannot see how. We are not having inflation. SSA requirements stay the same. I'd like to know whether the administration couldn't maintain the service quality. I'd like to know whether the Social Welfare Department will flesh out the details such as meal nutrition standards. I'd like to know how the administration is going to do with the KPIs. Thank you, Secretary. For the SWD 1, cash assistance for society, there's a substantial amount, about $80 billion, making up over 60% of the $130 billion. This is very meaningful. Over 800,000 elderly people in Hong Kong are receiving old age allowance, and over 400,000 elderly people in Hong Kong are receiving OALA, and over 200,000 people in Hong Kong are receiving PWD allowance. There are also other schemes in place, such as the Guangdong scheme and the Fujian scheme. In other words, there are cash provisions to solve these issues. The other percent you refer to is 40% SWD-operated homes and an additional 179 non-government-operated organizations. We're having an aging population right now, and this is out of the control of the SWD. As long as someone meets the age requirement, then they will be eligible for receiving the allowance automatically. Regarding the second question of Dr. Ng, it's about the nitty-gritty of the program. My colleague has already given you an answer. We cannot compromise service standard. This is a lump sum grant. The aim is to provide flexibility for people to make good use of the funds while adding more resources. We'll see if we can give you further information afterwards. Thank you, Mr. Brave Chen. Thank you, Chairman. Thank you, Secretary, and thank you, other officials who have joined us today. I'd like to follow up on 102 and 087. They are asked by Ms. Elaine Chick about asking suitable organizations in the mainland to join the scheme. I'd like to know what idea the administration has to create a neighborhood or community for elderly people in Hong Kong. Is there any plan in place? The government has provided funding to many drone technology organizations. Some of the facilities are actually quite good. We were led by the secretary to make visits. So I'd like to know in the future whether some facilities will be made mandatory for the homes. Do you have such planning? Do you have such budgets? Thank you. These two are very good questions. For the Residential Care Services Scheme in Guangdong, that is the GDRCS scheme, we have made a series of enhancements since I took office. We have already seen results. My colleague reported 1,100 elderly people in Hong Kong are currently residing in the 26 elderly homes in the 26 homes in 9 cities in the GBA. There's a ninefold increase. In the past 3 years, we have seen quite fast expansion. And the increase in the number of homes will not be as quick or as sharp as it was. Despite an increase in the number of people living in these homes, some of these elderly homes are already running their business in the Chinese mainland. They are just setting aside some spaces or bed spaces for people in Hong Kong. So we increased the number of elderly homes, but at the same time, we also ask these elderly homes to provide more bed spaces for people in Hong Kong. Mr. Chen, rest assured, there is definitely room for making adjustments. Next, on drone technology, we have a drone tech fund, a total of $2 billion about the drone technology INT fund. It's for eligible organizations and homes to apply for. We also encourage organizations to make such applications. We also welcome more reviews. Any good recommendations on drone technology? We also encourage more use of Hong Kong manufactured drone technology facilities or equipment, and we also encourage the use of the state manufactured equipment and facilities. Ms. Jeannie Mann, thank you. I'd like to follow up on 016. Over 30% of the graduates have chosen to continue with studies. I'd like to know whether the Shine Skill Center can actually help students. I'd also like to ask about 159. Question 2. The total number of cases handled remain the same, but on a monthly basis there's a decrease in costs. I'd like to know how the administration reduced the costs. There is inflation every year. It is already ideal if we do not see any increase in the costs. But this year, the administration is saying that they are having a decrease in the costs. So I'd like to know how the administration managed to achieve this. Any reduction in administrative expenditure or operational efficiency? Thank you. These two are quite detailed questions. I'd like to know if the SWD could take these questions. The first question is about the Shine Skill Center. I will ask the Permanent Secretary to respond. Ms. Alice Lau. Thank you. Regarding the Shine Skill Center, further studies mean having left the Shine Skill Center, these graduates continue with studies and they do not look for more jobs. Ms. Ginny Mann asked very detailed questions about the breakdown. I'd like to see if my colleagues can provide further information. Can Nancy take the question? Maybe we can provide supplementary information after the meeting. Ms. Jeannie Man's question is quite detailed. We'll provide detailed information after the meeting. Thank you. Next, Professor Lau Chi Pang. Thank you. I'd like to ask question LWB 148. This is my own question. Just now the Secretary touched upon this area. I'd like to follow up on the Secretary's reply. I'm asking about the residential care services scheme in Guangdong. I'd like to know if adjustments can be made. Based on our understanding, in the reply it is said that from 2 to 26, that is the number of elderly homes taking part in the GDRCS scheme. That's really a massive jump. From the end of 2022 to the end of 2026, there's an 8-fold increase. The difference is indeed significant, but at the end of 2022, the number stood at 1,048. 1,048 elderly people have chosen to go to the Chinese mainland. $79,000 elderly people are residing in elderly homes. Comparing with the amount of 1,048, the difference is significant. I'd like to know whether this is down to financial reasons. Is it because we cannot extend our services to Fujian? Or you have already conducted studies with elderly people and then they still refuse to go to the elderly homes in the Chinese mainland. I'd like to know whether the administration will strengthen promotion in this regard. If yes, how? If not, why not? Thank you. Secretary. Thank you, Professor Lau. Thank you for giving me an opportunity to explain this scheme. Among the 70,000 people living in the elderly homes, some of them are PWDs, whereas some of them are elderly people. There are 50,000 elderly people living in these homes. About 30,000 to 40,000 people are eligible for receiving the allowance or subsidies. Some people could not take care of themselves after we have conducted the standardized care need assessment mechanism for elderly services. But I'd like to emphasize whether they live in Guangdong or Hong Kong, that's the same. We need to extend the Guangdong scheme because we want to give eligible elderly people in Hong Kong one more option. We don't make any decision for them. We give them choices. They can either live in Hong Kong or they can live in Guangdong. They don't have to pay anything if they go to Guangdong. If they stay in Hong Kong, they have one bed, whereas they have a whole room when they go to Guangdong. We give them 6 months to give the homes in Guangdong a try. We know that they are worried about medical insurance, but then we also have a plan for them. There's a co-payment, and we have a total of 10,000 rebate for medical services, whereas about $30,000 for the rebate on elderly homes. About 50 or to 60 elderly people in Hong Kong are taking part in the scheme, but I believe the vast majority of people are still choosing Hong Kong. But with the scheme in Guangdong, we are providing one more option. Thank you.
Mr. Yin Kong, thank you, Chairman. My questions are about number 183. The estimates reserved for NGOs providing subvented services has increased by 8% to some $5.4 billion. Now, there are voices in society calling for an explanation about the portion of funding which goes to administrative purposes. In other words, we want to know how much funding has actually reached the needy groups. This figure, however, is not made available in the reply, and I understand that the SWD has not kept tally of the proportion of funding which goes to administrative fees, and there is not a cap. Now, in considering whether a funding amount is reasonable, we need to see the breakdown. So will the government encourage the subvented organizations to voluntarily disclose the cost structure according to a form set by the SWD? That should be breakdown including elderly care, family services and childcare and so on. There should be a reasonable range concerning the amount of funding which goes to administrative cost, so that there is an objective standard for assessing whether the level of cost is reasonable. Secretary, well, I get where Mr. Yim Kong is coming from, but as mentioned in the reply, the characteristic of the lump sum grant subvention system is to offer the maximum flexibility to subvented NGOs to provide services. We can adjust the requirements through the funding and services agreement to impose conditions on the NGOs. Now, previously, before the lump sum grant model, we offer funding for each individual program. So after some substantive changes, we have migrated to the lump sum grant subvention system. I know that many NGOs are trying their best to compress the administrative cost to deliver the most services available as possible. So there's already a lot of controls in place. Now, human cost is the largest item. The social workers would be spending a lot of time in the day to deliver the services, and at night time they would engage in administrative work. So will those hours count? We understand that all NGOs are doing their best to deliver services, but we will consider how we can ask the NGOs to give us a clearer account of how they spend their money. Please give us some time to consider that. Mr. Hong came in. Thank you, Secretary, for your effort. Now, I'm concerned about child protection. That's question 127, my own question. According to your reply, in 2025, different types of harm or maltreatment on children, we can see that in the table, the number for some types of harm are astonishing. Now, the number for sexual assault ranks first. The percentage is even higher than bodily harm and psychological abuse. That's really shocking. Now, second, on the abusers, parent rank first, and then peer and friends that rank second. Strangers or unrelated persons that rank third. Now, schoolmates, friend, and peer, they are mostly the abusers in sexual abuse cases. That's also the case for unrelated persons or strangers. So are there targeted preventive measures to protect children from these harms? If so, will more resources be allocated to these measures? If not, will the government do something more? Secretary. Thank you, Mr. Hong, for your questions. Now, with our efforts in the past few years, the mandatory reporting of child abuse system is now in place. Concerning preventive work and follow-up work, we have allocated more resources to these areas, as mentioned in other replies. For example, providing more urgent emergency placement, as well as establishing more supporting social workers team. So we will continue with that. We will triage the different reports of child abuse we receive every year. Now, to support families, there will be 4 new community parents and children centers, one of which has already been commissioned. Now, for parents who lack parenting skills, these centers will introduce positive parenting through play-based services. In terms of abuse between schoolmates, friends, and peers, which are sexual in nature, that requires a different kind of help. We rely on professionals in schools, social work sector, as well as the healthcare sector. Now, with the mandatory reporting mechanism is implemented, we hope that the situation will improve. Mr. Stephen Ho, thank you, Chairman. My question is on 63 and so on community care service vouchers and residential care service voucher scheme. The number has increased from 6,000 to 7,000 for LCSVs and 12,000 for CCSVs. Now, the DAB surely supports the increase. However, for other concession scheme like $2 scheme, I think the government should focus on cracking down on abuse. Now, with abuse, it would dilute the resources which can actually go to the needy ones. So we need to crack down on this seriously. Now, the reply mentioned that some participants have withdrawn from these 2 schemes. Now, back when I was serving the district, my ward office is near a care home or SWD. I could hear people talking about how they could scam the SWD, but without evidence, I could not report the case to the police. So, in August 2025, the government has done something very good to crack down on abuse of CCSVs, involving the help of professionals. So I understand that some people have submitted false documents to the social workers, but they are afraid of being caught, so they withdraw from the schemes. Now it shows that in dealing with the problem of 40 applications, there are some loopholes. I even know that there are care homes deceiving the SWD together with the relatives of their charge. So how can we crack down on these scammers? Secretary, I will defer the question to the Director of Social Welfare. Mr. Edward To, thank you. Now the SWD is the gatekeeper. We will punish those who deceive us. We adopt a risk-based approach with the aim to ensure that elderly people can receive our services in reality. So we would conduct a review on the records provided by the subvented organizations, for example, receipts and service forms. We conduct random checks. We will even conduct surprise checks on their services and interview the beneficiaries. When there are suspected deceptions, we would hand over the case to law enforcement departments. If bribery or corruption is involved, we will transfer the case to the ICAC. Now, I would like to promise the public that we will continue with the fair delivery of services. So if there are any suspicions, please do not hesitate to contact the SWD. We will continue to investigate the cases and make those accountable. Now, there are some assessment results which are clearly 40 that the elderly people do not actually need residential care. So how can you make sure that the assessment is watertight? Well, I believe the government has heard you. Mr. Charles Siu Chong, thank you. My question is on 77, on the supplementary labor importation scheme for residential care workers. That's a special scheme to import care workers for RCH. So in the past decade, we have been importing labor for RCH. In the past 2 decades, there are still some 10 to 11,000 local care home workers working in the industry. It's quite stable, but we are still importing more foreign laborers. So I hope the government can come up with measures to retain the more lucrative posts for local workers. Now, these 11,000 posts are mostly in better quality care homes. Now, according to the reply, before the special scheme, there are some 8,000 local care home workers and some 4,100 imported care workers. After the special scheme, the number of local workers has dwindled from 8,000 to 7,000. And as at the end of December 2025, there were only 6,474 local care home workers, down from 8,000. For imported care workers, the number has increased to 6,930 something. So it seems that the trend will keep going. There will be fewer and fewer positions for local care workers. So is there a way to retain the job opportunities for our local care workers? Secretary. Chairman, I thank Mr. Chow for his questions. The care workers in RCHE, there has been a chronic manpower shortage. That's why we implemented the special scheme to import care workers for RCH. Whether it is a private home or a subvented home, the scheme can be applied to ensure that there is sufficient care workers to take care of the charges. The purpose of this scheme is to give priority to the employment of local workers. However, according to our past experience, with insufficient manpower supply, it's very difficult to maintain the basic services in care homes. For example, bathing the charges and feeding. Now, besides encouraging young people to enter the trade, we are now providing more promotional prospects for the carers. They can be promoted to health worker or senior health worker. Now, the most junior posts are the hardest. For those who are capable and willing, we will help those care workers to be promoted to health worker. The next step will be health and nutrition worker. It's equivalent to a registered nurse or enrolled nurse in care homes. That's how we will protect local employment while ensuring sufficient labor supply for care homes. Thank you.
All right, Mr. Kenneth Lau, next member to speak. Thank you. I'd like to follow up on 199 regarding the limit on the number of concessionary trips and $2 flat rate come 80% discount. The initial estimate is $90 million, and the government needs to be responsible for $60 million. I'd like to know how this amount is arrived at. I'd also like to know the principle of the cost sharing. Secretary, thank you. Last year, the Financial Secretary asked us to review the $2 scheme, and then we have decided on $2 flat rate come 80% discount, which involved system overhaul, system upgrade, as well as the testing of machines. A lot of work is involved. There are over 17,000 octopus machines. Some can be handled by the MTRCL, some by the minibus operators, and so on. We have already tried our very best to reduce the costs. The last time the Joyu cards were replaced, the money was paid by the government, and this time round, out of $90 million, the government pays $60 million. The octopus company needs to pay a certain level of amount as well. From an octopus card without an image, then this time round we have the Joyu card with an image. We think it is impossible for the government to fully fund the program. The private sector also needs to pay a certain level of amount. This time we are going to finish the system overhaul in 1 year. The time taken will be shorter, and there will also be more manpower needed. That's how we arrived at this figure, and we consider this cost-sharing arrangement reasonable. Mr. Lau, anything else to add? No? Next, Ms. Nixie Lam, thank you. I'd like to ask about 006 and 140. In 006, about the newborn baby bonus scheme, $20,000. $1.31 billion were spent. The newborn registration rate has seen a drop. For simpler cash assistance, the effectiveness may not be as great. There has been quite a lot of discussion in society. In the private sector, there are more family-friendly employment practices. Can we consider providing tax concessions so that companies in the private sector can provide more in-house measures? I'd like to ask about the possibility of offering tax concessions. In answer 140, regarding the school-based after-school care service scheme, we have seen an increase of 80. This shows demand for such services. Has the administration taken stock of the program? What are the views of parents? Any views on fees? Any review conducted? Thank you. Of course, it is the Financial Secretary that will make the decision on newborn baby bonus scheme. We have just related the situation, the reality to the FS. Regarding the FFEP's family-friendly employment practices, this is within the remit of the Labor Department. We have the Good Employer Charter and the scheme. Enterprises of different size also implement different FFEPs. They do not necessarily require tax concessions provided by the government, but tax concessions are not within my purview. I will relay this in view to the relevant policy bureau so that they will consider it. Regarding the after-school care program, the Permanent Secretary has already answered. It is very effective without doubt. This scheme has helped parents as well as mothers who did not have a job. They could return to the workplace. I have children as well. In the evening, we need to do homework with our children, and this is oftentimes the most difficult time. However, after the implementation of the school-based after-school care service scheme, when students go back home, they have already finished their homework. Then they can enjoy family time with their parents. The improvement in family relationships is not measurable just by money. As the Permanent Secretary said, there is no limit right now. As long as schools want to participate in the scheme, then we will try to let them join it. Thank you. Mr. Linchik? Thank you. I'd like about 132 and 092. First of all, 092, I'd like to ask about the hotline for carers. Are there still 30 lines? In a reply, it is said that about 170 requests for assistance daily, averaging 20 minutes per call. In other words, per line every day, one line needs to take care of 6 cases. It seems we have sufficient lines, but I'd like to know whether there is any peak in the carer hotline, any particularly busy time. Some carers could not get through the hotline because the lines are busy. Is it possible to provide more hotlines at the peak so that there are more operators picking up calls? Thank you. Next question is about 132. It's about neighborhood support childcare project, about 2,100 community nannies. Well, I understand this is not a 1-to-1 ratio, but per community nanny, they take care of 4.7 children on average. So I'd like to know whether the demand is outstripping supply. Do you have information about the supply and demand? Any particular district is having oversubscription? How can we increase the supply? If there is not enough supply, we cannot help the families that really need our help. Thank you. I'd like to ask Ms. Leung to respond to you. Regarding 182, 183, there are a total of 30 lines. But the Tonghua group of hospitals is handling the calls very flexibly. In the evening, there are more carers calling the hotline. That is because in the evening, when the elderly people they care for is taking a rest, then they have time to make a call to the hotline. But rest assured, we have sufficient manpower. And the operating organizations are also telling us that they managed to pick up all calls. When there are any incoming calls that they could not pick up, they reply to the voicemail very quickly. In addition to picking up calls, they also provide services for outreach services as well as emergency placement services. So they don't spend all time picking up calls. For emergency cases, they deal with them using outreach services. And the next question is about the Neighborhood Support Childcare Project Service Scheme, that is about home-based child carers. There are small groups in community centers, and the ratio may not be 1-to-1 or 1-to-2. In the centers, they provide group services. We keep a close watch on the supply and demand situation. So far, we managed to provide sufficient supply. There is no waiting required. Next, Ms. Kwok Foo-yong. Thank you. I'd like to follow up on my own questions, 132 and 133. 132, it's about aided childcare centers. In the reply provided by the administration, Chinwan, Kowloon City, for these aided CCCs, the utilization rate is 100% across the past 3 years. That is indeed good. This shows the facilities are well used. It also shows that in a community there is demand for such services. However, the document fails to mention the waiting time. Therefore, we have no idea of how large the demand is. If the waiting list is very long, if the quota across different centers is not the same, so how can we evenly distribute resources? How can we distribute resources having regard to the different demands in different districts? My next question is about 133, about elderly services. An increase of 0.9% dedicated to elderly services, but of course in Hong Kong, we have an aging population as mentioned by many members here. according to the Hong Kong Planning Standards of Guidelines for district with over 170,000 people in the area, then there needs to be one elderly neighborhood center. However, for new districts of 15,000 to 20,000 people, then there needs to be a neighborhood center. I'd like to know whether adjustments can be made taking into account the population density of elderly population. Take Tsuen Wan and Kwai Ting areas as an example. They have a total of 800,000 elderly people, but there are only 2 elderly centers and 1 neighborhood elderly center. I'd like to know how resources can be distributed. We need to target the population of elderly people in the area. We don't just meet the requirements on the surface. For elderly services and for child services, there is indeed great demand. Based on the population standard, we try our best to provide aided CCC and elderly centers, but then they come with their own restrictions. For example, for aided CCC, it cannot be over 12 meters or above, and for other centers, they cannot be garage nearby. There are different restrictions. For newly built facilities, we will try to add more facilities. We cannot provide 100% matching, but rest assured, for areas seeing a shortage, we'll try to add facilities to area with a burgeoning demand. We understand in some districts, population is aging more quickly. The population of elderly people does move, and the figures keep changing. Are we talking about the number of elderly people at this moment, later on? These figures do change. We'll try to be flexible in order to respond to the population of elderly people across different districts. Thank you. I'd like to follow up on 003, Community Living Room. This service is very popular. There's been an extension from 3 years. I'd like to ask the administration, do you have any target in relation to the total number of community living rooms? The fact that there has been an expansion shows that there is value. Will the project be regularized? This is indeed a novel scheme. Will there be any other novel schemes that can help the community? Thank you. Thank you, member, for your question. This is indeed a good question. Upon the rollout of community living rooms, we already said it was a tripartite collaboration among the government, public, and the commercial sector. We needed to try whether a policy would work with the Community Care Fund. We initially started with 3 years. As Mr. Wang said, some community living rooms ran for 3 years initially, and then we extended some particular community living rooms by another 3 years. Then we used the funds from the community care funds. At present, there is no cap on the number of community living rooms. We hinge on tripartite collaboration. The government, the community, and the commercial sector. If there are private organizations or charitable organizations that are interested in providing community living rooms, we of course welcome this. As long as they are willing to provide a venue and renovate the venue, then we can have more community living rooms. Will it be regularized? Well, we prefer extending the community living rooms, allowing for greater adjustments. Circumstances in society change. When there are changes in an area, then the demand will drop. We believe the tripartite collaboration model is the most useful. It is the most useful in tackling problems with the time limit. Thank you.
Next, Mr. Mark Chong. Thank you, Chairman. I would like to follow up on my own question. That's number 107. According to the reply, the Social Welfare Department does not keep tally of the number of suspected or established fraud cases concerning CSSA. In the past 2 financial years, there were some 1,870 substantiated cases of fraud involving some $154 million. That's not a non-substantial amount. So why didn't the government keep track of the number of cases? These are public fundings, and we cannot just let the cases slide. Now, number 195, the Joy You card. In August 2024 and February 2025, together with public transport operators, the government has conducted some 270 joint operations to inspect 1,370 suspected breaches. In the end, no cases were found. At the same time, the NDRC has conducted inspection as well, but on average, there were 8 cases of breach every week. So why is that such a big difference? It doesn't make sense if there are less people abusing the system on public bus. Now, thank you. Concerning CSSA fraud cases, I would defer to my colleagues. Deputy Director, Ms. Nancy Kwan. Thank you, Chairman, and thank you, Mr. Zhong, for your view. We have been actively recovering the amounts deceived from the cases. For CSSA recipients, we would discuss a repayment scheme with the person in question and deduct the amounts deceived from the CSSA payment. For non-CSSA recipients, we will also recover the amounts deceived actively. Chairman, the other question is about the $2 scheme. There are law enforcement operations being conducted as mentioned in the reply. Our colleagues are working very hard to conduct these operations. We would like to send a very clear message to the public on 2 tiers. There are some who are using elderly card who did not belong to them, but that has been eradicated because we have the Joy You card now. So we will not speculate the situation for buses. But these are the results of the joint operation. The point is we are sending a strong and clear message to those with unscrupulous intent that we will take surprise actions. If you are caught, then you would be fined thousands of dollars with a conviction record, and that's not worth it. Now, the inspections were conducted during the same period. Why was it that the NTRC were able to find more rule breakers? Is it because MTRC staff can stand next to the turntiles and catch the breaches? Now, an And a simple answer would be that there is some 4 million patronage for the MTRC each day. Ms. Christine Fong, thank you. My question is on number 37, Ms. Maggie Chan's question on the number of CCCs, and my own question, 116, a community care voucher scheme. For child care centers, from standalone CCCs and CCCs come kindergarten, there are CCCs in Sai Kung and Sha Tin with keen demand. So in terms of allocation of resources, there are lots of families with newborn babies in Cheung Kwan O. It's a new town, so please strengthen support for Cheung Kwan O families. Now, 116 Community Care Voucher Scheme and RC and Residential Care Voucher Scheme, these are very popular schemes. They adopt the model of money follow the recipients so that the elderly people can make use of the subsidies flexibly. Now, the budget mentioned that more funding will be injected into these schemes. For instance, there would be an extra 1,000 community care voucher scheme, bringing the number to 7,000. So, at present, there are 1,819 holder of care vouchers for community care services and 353 RCSP holders who are not using the services. Why is that? Is it because there is a lack of suitable service units, or that the service is only available cross-district so that the voucher holders are hesitant to use them? Will the government introduce regular third-party review and gauge the feedback from the recipients to enhance the service? Secretary. Thank you, Ms. Christine Fong. These are very concrete questions. I would defer to the relevant Deputy Director, Ms. Maggie Leung. Thank you. Concerning the residential care service vouchers for the elderly, or CSVs, the voucher holders are very mobile. Now, there is a small number of voucher holders who have yet to use the service, but it actually takes time for them to choose the appropriate services. Now, by way of figures, at present, for CCSVs, there are 322 recognized service units across the territory. So these CCSV holders may use the vouchers at different locations in Hong Kong. For example, they can spend the vouchers in a center setting to receive physical therapy or occupational therapy, or they can choose to receive service at home. So the users enjoys a lot of flexibility in terms of service delivery model. We will keep an account of the number of voucher holders who are not using the vouchers. They will be contacted on an individual basis. If they reply that they do not need the vouchers anymore, the vouchers will be transferred to other users in need. Mr. Andrew Lam, thank you. Question number 9 and 142. First on Shine Skills Centers. Now, we still don't have the figure for year 2024 and 5. So when will we have the figure? Before we have the information available, looking at the previous 2 years' data, you can see that supported employment, the number of persons and percentage has decreased. However, for seeking employment, the percentage has seen significant increase. So how do we understand this scenario? Second, 142, data platform for carer support. Now, I support this platform, and it seems that the platform will be extended to buildings of the housing society and 3 new buildings. I think that's great. Now, the data platform has been up and running for the better half of a year. So can the government give us a comparison before and after the establishment of the data platform? Since this is a good idea, can we expand the function of the data platform to streamline the application procedures for carers? Secretary, thank you. First, on Shine Skill Centers, the percentage of applicants requiring support in terms of employment seeking and other services. Now, the figures vary year by year. It's very difficult to conduct a scientific analysis on the changes over the years. Now, the purpose of these figures is for monitoring the trend. If there is a very significant trend, we will adjust. In terms of seeking employment, we have the Good Employer Charter. We would encourage employers to hire disadvantaged workers since they are very capable as well as loyal. Now, the data platform has been up and running for half a year's time, and like the member said, the results have been admirable. So it helps us to target our efforts on those potential service users. Now we can pinpoint the user's location and conduct outreach and see if they require support from the SWD. So in terms of referrals, we have made thousands of referrals based on the data platform. Now, for some cases, if we did not reach out to the case, they would even have trouble getting food on table. Now, in terms of data platform, according to the discussion with the Commissioner for Personal Information Privacy, on the premises of privacy, we will expand the scope of the data platform, including housing society building projects as well as 3 new buildings. The main difficulty is not in the connectivity of data, but how to follow up on the case. Identifying the case is just the first step. It will only be meaningful if we can deploy a team to follow up on the case. But please be reassured we will not spare any efforts on this. Mr. Wu Yingpeng, thank you. My own question. Number 19. Now, in January this year, the mandatory reporting mechanism of child abuse has been kick-started. It marks a milestone in child protection. So the government mentioned that the preparatory work 18 months prior were very robust. For example, the electronic platform has received some 180,000 visits, and also some 26 reports have been received in the first few months. So according to the reply, there are no KPI sets for the mechanism. So at present, how does the government assess the success of this mechanism? I know it is difficult to monitor the efficiency of a mechanism, but at least there should be one KPI to gauge the efficiency of the mechanism. For example, the ratio of cases being referred for investigation and also the amount of time required for first respond.
Secretary, thank you, Mr. Wu, for the question. I know where Mr. Wu is coming from. We're on the same page. The reason why we passed this ordinance is that we want to, first of all, prevent child abuse cases and intervene when it does happen, unfortunately. However, when it comes to setting a KPI, we will go back and think about it. Regarding the most ideal situation, we don't want to see any reports. In other words, there is no child abuse. When there is a report, it means there is already a child abuse case. It is unreasonable to have a KPI. However, we do have a mechanism to follow up on the case once there is a report. It will not be followed up on by one single organization. We have a multidisciplinary mechanism to intervene. The mechanism actually kicks in whenever there's a report. Regarding the time, I will have to think about it. When we know there's a child abuse case, then we race against the clock to handle the case. If we have very minor breakdowns, colleagues will have other matters to attend to. Of course, we want to help the child in question. I understand Mr. Wu's point. We will give it some thought. After the implementation of the child abuse ordinance, indeed we have had a lot of work. We'll try to see how we can help the public to know what we are doing. Thank you. Ms. Rebecca Chen, I'd like to ask about 025 and 026, about supporting SEN students, about the OPRS scheme, that is the on-site preschool rehabilitation services. Kindergarten teachers and parents agree that this scheme is actually very good. It was so good that in 2024 to 25, the waiting time was 0. The service model is very good. Therefore, I'd like to know how we can keep it going. We may even have an expansion. There is more and more demand for support services provided to SEN students. The number of SEN students keeps increasing across the secondary and primary school stages. OPRS is targeting students in kindergartens and the first stage of primary schools. Otherwise, students will have to rely on the 3-tier support, or parents may need to look for other services. I'd like to know whether we can expand this scheme from the kindergarten to junior secondary as well as senior primary. If there are concerns, what are the difficulties? I'm also concerned about the manpower. I can see the staffing establishment of OPRS. Not many people indeed. You have senior special childcare workers, speech therapists. I'd like to know whether we need to provide more resources to those who have more opportunities to engage with the children. Therefore, they need more resources. Ms. Lau, thank you. I thank Ms. Chen for her question. Regarding the OPRS, we have already dedicated a lot of resources and thought to this scheme. These children and their families need support, but above all, we need to seize the opportunity of the golden period. At the preschool stage, these children need our help the most. We are more concerned about the cost effectiveness of the program. And at this stage, we find it the most cost effective. That is why we are glad to see that at this stage we have managed to reduce waiting time to 0. Why we could do that? Because on the use of resources and on cross-discipline collaboration, we managed to provide the most targeted support to students. Therefore, they do not have to visit elsewhere. They don't waste any more time before they can receive the support they need. In different development stages, they receive the targeted assistance that they need. For example, some have retarded growth, some have learning difficulties, and we provide targeted support. In secondary schools, children need different support, and a lot of changes might take place. In secondary schools, if students still need special education needs, then educational intervention might be needed. It is rare that we will intervene from the perspective of social welfare. We're willing to work with the Education Bureau. For the transition between kindergarten and primary schools, we do hope that we will broaden and deepen our work in this regard. Permanent Secretary, please be succinct. Thank you. Ms. Lau Ka-Keung. Thank you. I'd like to follow up on LWB 151. In 2023 to 24, LCSV applicants account for about 41%. I mean, those who fail to get the vouchers account for 41%. Whereas 87% of the applicants have withdrawn their application. This figure is on the high side. I'd like to know the reasons behind it. Can the administration share the figures with us? Is it because of the quality of the homes, or is it because of the fact that some applicants could not pass the means test? Thank you. I'd like to ask my colleague to take this question. Just now, member referred to the RCSV scheme. It's mainly due to the physical condition of the applicants. They need to undergo a standardized assessment first before the application. And when they receive RCSV, there might be changes in their physical condition, or their family members may have other options. For example, they may want to take part in the Guangdong scheme, so they have already withdrawn from the application for RCSV. Some do not want to stay in these elderly homes. They want to stay home, or they want to stay in their own community. They may prefer aging in place. That's why there are different reasons that these applicants have withdrawn their applications. Thank you. Mr. Bill Tang. Thank you. I'd like to ask about 176, 177. One on the old, one on the young. 176 about your technology fund and the register of elderly people. My first question is that for 3,000 households of elderly people, some of them are elderly doubletons. A total of 3,000 households were referred to the relevant department, and EAS was installed. Some elderly people acknowledge the function of the EAS, but then they still refuse to install the EAS. That is because 1 year later they will have to pay for themselves. So how does the administration think about the effectiveness of the scheme? Will the administration consider extending the scheme not just 1 year? 177, the policy address mentioned 300 households will install the fault detection systems. 300 is indeed a small number. Are you going to implement this in just one district or all over the city? 177, upon the implementation of the mandatory reporting of child abuse ordinance, a total of 66 cases were received. I'd like to know whether all of them are from the 25 regulated professionals I'd also like to know whether all these cases were reported through the guidelines or the decision tree. Thank you. Community care teams visit different households. The EAS is funded for a year. Is it possible to fund the EAS for more than 1 year? It's always possible, but then we may have to reduce expenditure on another area. So why not just pilot this area for a year, and then if needed, we may extend it. It's not carved in stone. Regarding drone technologies, we will start with 300 households. We want to see which type of drone technology is the most effective. This time, we are going to test 2 models. They will be tested in tandem. Then, we see which one is more effective. The funds are provided by the government. Instead, it is provided by a charitable fund. If the scheme is proven effective, then we can extend it. It's like phase 1 of the clinical trial, and of course we do want to do better when it comes to this. The mandatory reporting of child abuse for the 66 cases, yes, they are from the 25 categories of specified professionals, but were they reported through the decision tree? All these cases were reported by the specified professionals, and the decision tree was provided to the professionals for reference. That's why it doesn't require the professionals to tell us whether they have drawn reference from the decision tree, but we can tell for sure that these cases were reported by the specified professionals through the system. Thank you. Mr. Chen Pui-Leung. Thank you. I'd like to ask about 182, 189 and 192. In 189, about the $2 scheme in 2026 to 27, the amount involved is $5.17 billion, whereas in 25 to 26, the amount stood at $4.6 billion. Up by 11.2% year on year. However, in the administration's response to Mr. Chen Xiuhong in 192, it is expected that about $550 million are expected to be achieved, are expected to be saved. That's why I'd like to know why in 2026 to 27, the savings expected to be achieved will total $550 million. Well, the simple answer is that we have already taken into account the saving of $550 million. Without this amount, our revised estimate will not be $5.1 billion. I understand Mr. Chen's point. The mathematics just doesn't add up. Are you lying? No, because we have managed to save $550 million. That's exactly why the revised estimate is $5.1 billion. These figures actually tally. I'm just afraid I got you wrong. Am I correct? Yes? Alright, thank you. Mr. Kingsley Wong, I'd like to ask about 182. Question number 4. Disability allowance not incorporated into the Guangdong and Fujian schemes. These 2 schemes are indeed very good. Elderly healthcare voucher schemes can be used in these 2 schemes. However, in the reply, medical assessments must be undergone by DA applicants conducted in Hong Kong. I received a complaint from a visually impaired individual. According to a document in 2013, from the perspective of rehabilitation, the standards of China or of the Chinese mainland are different from those of Hong Kong, and we haven't yet extended the disability allowance from Hong Kong to the Chinese mainland, but a decade or so has passed. There are grade 3A hospitals in the Chinese mainland. So will the Secretary consider relaxing the requirement? Will disability allowance be incorporated into the Guangdong scheme as well? This will provide more convenience. If they need to come back to Hong Kong, it might be difficult for them to come to Hong Kong to even just live with their family members. Is it a good time to make the relaxation? Thank you.
Chairman, I thank Mr. Kingsley Wong for his question. That is a real dilemma. From a sensational point of view, of course, we want to extend the scheme to Guangdong and Fujian. However, from the aspect of usage of public funding, there is risk. Whether disability allowance is granted is based on doctors' judgment, and only doctors in the public healthcare sector can make that decision, because we need to be the gatekeeper. There are some hundreds to 200,000 of claimants of disability allowance. It involves billions of dollars. So we need to come up with a scheme or plan to control the risk of abuse. If we open the floodgates, we will be placed in a very awkward position. We understand there are lots of calls for extending the disability allowance scheme to Guangdong and Fujian, but we haven't overcome the hurdles yet. Disability allowance is not granted based on your age or your financial means. In principle, you can just ask a doctor to certify your condition and then you can get disability allowance. So this is a mechanism based upon the credibility of our public health care system. But we understand the suggestion made by Mr. Kingsley Wong. We will try to come up with ways to help disability allowance recipients. Next, Mr. Grace Chen. Thank you. My question is question 25 and 6 asked by Ms. Rebecca Chen. Now, concerning reducing the waiting time to 0. We need to have a perfect match between supply and demand. However, over the past 3 years, there has been 5,000 applicants and 6,000 service recipients have withdrawn from the service. So about the situation of 0 waiting time, how long will that last? When the queue comes back, will the government reallocate resources internally for applicants for the on-site preschool rehabilitation services? If that's the case, then each service recipient may receive fewer hours of services. So will the government ensure that there is a minimum size of establishment for delivery of the OPRS? Secretary. Thank you, Ms. Grace Chen. That's a very valid question. But let's look at the broader picture. Over the years during which the OPRS has been delivered, we have achieved 0 waiting time because, as the Permanent Secretary has mentioned, we need to seize the golden period for rehabilitation. Beyond that period, our efforts would be less efficient. So we are doing our best to achieve 0 waiting time. So if we can't achieve that, if the situation deteriorates, we will deploy more resources to the service. The point is we need to seize the golden period for intervention. We will help as many students as possible, even just one more. With OPRS, we can have the students study in mainstream school rather than special school. That would save a lot of cost on the family's parts because the cost for a place in special school is much more expensive than mainstream school. Now, frankly speaking, you can see that we have fewer and fewer children with a declining birth rate. So we want to help as many children as possible. If there is a trend that the queues are coming back, we will secure more funding for this service. I really appreciate the government's commitments. Golden period is really important. Next, Mr. Michael Lee. Thank you, Chairman. Question 152, community care services vouchers. Now we have more and more elderly people moving to Guangdong. They cannot use the community service care vouchers in Fujian and Guangdong. But can we adopt the model of the elderly care voucher scheme to have the money follow the recipient so that they can spend the vouchers on recognized service providers in Guangdong and Fujian? Now 175, again, the Guangdong and Fujian scheme. Now the elderly people are receiving the subsidies through their mainland bank accounts. But what about cross-boundary ambulance services? And also about application of Hong Kong of medical device and drugs used in our healthcare sector. If we can extend the scheme, then we can reduce the trips made by retirees in the mainland. Now, the second question is under the remit of the Health Bureau. We will convey the question to the Health Bureau. Now, for the CSSB, at the moment, we don't have a plan to allow money follow the patients. Now, usually, for those holders of RCSBs or CSSBs, they are usually immobile. If the elderly person can still cross the border to receive daytime service in the mainland, then they should be in relatively good health. So if they can bring the CSSB across the border to the Bay Area, that means that they are not our target. So far, we are only allowing those requiring residential care to spend the vouchers in the mainland. Now, if you are saying that an elderly person is in poor health and cannot self-care, but they can cross the border to use CSSBs, that doesn't make sense. But we will study the question. Next, Mr. Nick Chan. Thank you. I'm following up on question 127. Now, in the reply, there is an annex. In 2025, newly registered child protection cases. Among the new cases, there are different types of harm and maltreatment. The abusers are people related to the child in different capacity. Now, I'm shocked to see that in the first column, parents account for over half, 56.3% of the cases, including physical harm, abuse, neglect, sexual abuse. I'm particularly concerned about psychological harm and abuse, and also multiple harm. Are there guidelines concerning psychological harm, and whether that includes mental harm? Now, in early April this year, and also a reply given by the Secretary last year, you mentioned that under the offense against person ordinance, under the ordinance, for those who neglect or maltreat a child, they will be subject to punishment. Now, if the action of the adults results in unnecessarily suffering or detriments to the health of the child, that will also constitute an offense. So will the government consider allocating more resources to study whether we should define the harm under Cap 27 to include mental harm and give it a definition? Well, Chairman, I am not sure whether I follow the question, and I'm not sure whether it is about resources, but I will try to tackle this question. Now, the SWD's concern is to ensure that the implementation of the mandatory reporting mechanism is a success. So this table will continue in the future. So besides those cases requiring report by law, there are other cases which have been reported, but those are not cases requiring reports by the law. So there are more than 66 cases reported in the past 2 months. Some are not mandatory reports according to the law, but still they have been reported up the chain. So concerning psychological harm, may I defer the question to the Deputy Director. Now, there are different forms of child abuse. As seen in our reply, besides physical abuse, there's neglect, psychological harm, and that's similar to emotional or mental harm. Now, when we're dealing with suspected child abuse cases, we would adopt a multidisciplinary model. The relevant professionals, including pediatricians, the teachers, and also the case managers, would be brought together in a multidisciplinary case conference. They would analyze whether this case falls within the realm of child abuse. Now, you mentioned the scope of psychological harm, and most of the time the abusers are the parents. You can imagine, because parents are the closest ones for the child. Now, because of the lack of parenting skills or inherent emotional problems on the part of the parents, they might harm the child psychologically or even physically. So we will tackle this from a multi-pronged aspect. So as the Secretary mentioned, we have established Community Parents and Children Center, and last year we have established 6 child protection teams to offer help to the parents and the child. Thank you, and government officials. That concludes this session. The next session will start at 5:10. Thank you.